in order to do electronic billing, we interface with Office Ally as a claims clearinghouse. And the best way that I can describe them as an analogy would be that they're the post office. We get everything formatted in our system. We supply it to Office Ally, and they're the ones who take a look and make sure it's addressed correctly, so to speak, and send it on to the insurance companies. They have the computers that connect to all the insurance companies across the nation. So that's what their role is, and then they also retrieve messages from the insurance companies back to you. So they have a very much like the Postal Service. So one of the first things that you'll do in Office Ally, and you've probably already done that before, but if you want to do electronic billing through our system, you'll need to enroll with Office Ally. If you're a group entity and billing under group NPI number, you only need to enroll for your group, once for your group. If you're an individual, each individual needs to enroll, so you might have some groups of independent practitioners, and it's each of them might need to enroll. A couple things here is you'll just fill out the form. I think most of it is fairly self-explanatory. There is just one part down here where it asks you'll be using another billing software, and you'll put therapy appointment in this blank. You are not interested in their credit card processing. This is not the credit card processing that integrates with our system, just to let you know. And your Office Ally representative, if you'll click therapy appointment, that's all you'll need to do. And then they will send you, talk to you and send you a contract to fill out as far as the basics, and they'll get you started. Once you fill in this form and they connect with you, they will automatically send us your connection information. And so we'll get that automatically in our system and get you connected. So once you set this up, give us about 3 business days for them to get things set up on their end, and then we receive the information and get it set up on our end for you. Okay. So there are a couple things with Office Ally that as soon as you set up that enrollment portion that you're going to want to know about. And one of those is the Resource Center under Office Ally. Now you can access this area without being a Office Ally member. You don't have to be logged in to do it. But they have some excellent resources here that you're going to need. And I promise you, after you have this set up, you'll rarely need to go to Office Ally to do anything. So they have a list here that says Payer Lists. And if you click on Payer List, this is going to bring up some choices here. And you want to choose Professional Institutional Advice. And this list is going to list all of the insurance companies. There are 32 pages worth of insurance companies here. And I'm not sure how many on each page. I'm guessing around 50. That's a lot of insurance companies across the nation. So if you're looking for your specific insurance company to see if it interfaces with Office Ally, then you would simply type in the payer name here, like Aetna, and the type or model, you can just leave that blank and type search. Click search, and this is going to run a search on their website of all the Aetna insurance companies out there. And you can see the payer name here, a payer ID number, 60054. This payer ID number is, think of it as it's an electronic ID number that every insurance company has. And this is going to tell our system and Office Ally where this claim gets submitted once they receive it. So for example, if you bill Aetna, the payer ID number is 60054. They couple things across the top here for headings just to be aware of. The first one is enrollment, ENR, pre-enrollment required, no. So in other words, as soon as you're set up with Office Ally, you're ready to bill Aetna. No other forms need to be filled out. And then if you'd like to have your claims come in, the auto post into our system, the other thing you need to know is ERA. ERA, yes, they allow for ERAs, so good news. With Aetna, you can bill them electronically, and they can send you their ERAs electronically, and they're going to be a very, very easy one to manage in our system. Okay, that's what we want it to be able to do. There also, the type of insurance is CP, that's commercial or a participating plan. With Office Ally, if more than 50% of your electronic claims go to a government or non-participating plan, you will be charged $19.95 a month in a month that happens in. And that's only going to be, so typically if you have a lot of Medicare clients or TRICARE clients, some Medicaid plans, just depending, but you can see if that plan falls into a government plan because it would have GNP here on the list. And if I'm scrolling down here in this first page of Aetna, I don't see any of that being GNP on the type, so it just falls under that regular category. Okay, so that's how you would look up the different insurance companies. So, example, Blue Cross Blue Shield. I'm going to do a search here, and I just put in blue. It's going to give up my most opportunities here. So here's Blue Choice of South Carolina. There's two of them listed here, but they're both the same payer ID number, no pre-enrollment required, and it looks like they provide ERAs, so that's great news. Okay, so you would just look up your insurance companies that way and find out what Office Ally's payer ID number is for these plans. Okay, so that's step one. Step two is going to be, once you have an Office Ally account, logging in with your username and password. And I'll see if I can remember mine. They make you change it about every 2 months, it seems like. And so I'll see if I can actually remember mine and get in here. Maybe. I remembered. See, it's going to expire next time I use it. Okay, so only one thing you need to do here, and that is go into the admin section of Office Ally and go to duplicate filter setting. And you want to turn off deduping. Sounds weird. It's like a double negative. But this is what, when you log in, yours is going to look like. I'm going to set it up so it looks like that. Okay. All right, let's go right here. Duplicate filter setting. So right now, the current duplicate filter status is on. In other words, they're going to keep duplicate claims from going through in their system if you're trying to send a claim back through within 90 days. You want to turn that off. Number one, because if you're fixing a claim and need to send it back through, their filter is going to catch it and say, "Oop, you've already sent this claim in." And in my what I'm doing is I fixed something and I'm resubmitting it, so I need to resubmit it. So you're going to turn it off permanently. It's going to ask for your name, and you can type in your name there, and you're going to say turn off deduping. It's going to say, are you sure? And the answer is yes. That filter is really there for large hospitals that are sending in thousands of claims a day so that they're not double sending in claims. If you double send in a claim, what's going to happen is your insurance is going to pay one of them, and the second one they're going to deny and not pay you anything on, which is what they should do, right? You're not going to get double paid for those claims. All right, so those are two things in Office Ally you're going to be doing. You're going to be looking up your insurance companies and payer ID numbers. You're going to turn off the deduping filter. There's one other place in Office Ally that you want to look if you want to set up for electronic posting of your insurance EOBs to happen within our system. And that is under the Resource Center, there's payer enrollment forms. These payer enrollment forms, two things. If your insurance company does require pre-enrollment, you'll see it on this list. So for example, if you're part of any of these insurance companies and billing them, Cahaba, Adaptus, DMERC, Value Options, TRICARE for Overseas, then there is a pre-enrollment form to fill out before you can bill them electronically. Once that's filled out and accepted, you'll be ready to bill electronically. If your companies you bill are not on this list here, you're ready to bill right out of the box when your Office Ally is set up. If there is a company that you need to pre-enroll for, it'll be listed here. So here is, no matter who, if you live in what state, if you build these companies, there's a form. If you live in Alabama and you build Blue Cross Blue Shield, they do require a pre-enrollment form. And if you click on Blue Cross Blue Shield of Alabama, you're going to come up with a PDF file from Office Ally, and it says it takes about 2 weeks to set up. And it just walks you through that whole task, and it gives you the form with most everything filled in for you already. You're just going to be filling in Section 1. You're going to be filling in the name of your providers and tax ID numbers, and you're going to be signing and dating it, and you're going to be pretty much faxing it in. It's a pretty simple form. So if you'll just follow the rules and fax it in, you'll be set up to bill Blue Cross in about 2 weeks if you live in that state. Many states don't require you to fill that in. It's just a state-by-state issue, and wished it was a little more simplified process than that. But as you can see, in Alabama, probably the only thing you have to worry about is Blue Cross Blue Shield, and if you're a Medicare provider, then you'll have to fill out a Medicare form. So you can scroll down and see every state listed here. California has quite a few. Connecticut, very little. So you may live in a state where you don't have to do much. Most of the majors are already, you're ready to go out of the box. You can see there's really very few out of the thousands of insurance companies that require any pre-enrollment form to be set up for electronic billing. There's one other place you'll want to take a look at, and that is the electronic remittance /830 ERA/835 enrollment forms. This is a electronic file which is the equivalent of your paper EOBs, okay, explanation of benefits. So if you will set up and click here, and you'll find, for example, Aetna 835 ERA and EFT. ERA means electronic remittance advice, and EFT means electronic fund transfer. Electronic remittance advice just sets up for that EOB to come into Office Ally and thus upload into our system and automatically post for you. It's a huge time saver. I encourage you to do that. If you'll just print off this form, you'll click here and get to other forms. It's a very simple process. It's not very, it's a pretty simple form to fill out, and it's pre-filled out for you for the most part, again. And I think you can even e-sign it right here on their list, and right there is where you need to fill out. Everything else is filled out for you already, and it works pretty well. Okay, so click to e-sign, and then I think you can either fax or send it right off to them. So do that for every insurance company that allows you, that has ERAs available, and that'll make your time with us very enjoyable as far as having everything auto post and be a huge time saver for you. Okay. Now I'm hoping when I click this I don't get myself out of the meeting. Okay. That's going to complete the time that we spend in Office Ally. After you have those things set up, you really won't have a need. You'll rarely ever be in Office Ally for anything. Okay? Everything will come through into Therapy Appointment. So let's look now into Therapy Appointment. And I'm going to stop and just take a minute and see if any of you have any questions about Office Ally before we go on. And feel free to chat about that, or I will take us off of,
All attendees are unmuted.
Any questions? Any questions about Office Ally so far, or setting up for enrollment for certain insurance companies in your state? Okay.
All attendees are muted and may unmute themselves by pressing *6.
Then the next thing that we need to do here is we need to talk about setting up your insurance database in Therapy Appointment. Now, the insurance database is located on your blue column of navigation buttons, and it says Insurance. And if you click on it, it's going to say New Insurance Company. Click here after selection. If you've already entered some insurance companies into the library, then you'll see, when you click on this, you'll see a list of all the insurance that you've already entered. But if you want to enter a new insurance company, you'll simply click here after selection, and it's going to bring up the fields to fill out. Now, we do it this way because every state has different insurance companies, and there are thousands of insurance companies on Office Ally database. So you'll simply be putting in the company name. So let's just say that this is Diamond Insurance Company. And the type of health plan, it's a group health plan as opposed to a government plan such as Medicare, Medicaid, TRICARE. Okay. You also have the option of other. Let's say that you have an EAP that you bill, and you would like to put that in here into the database, which I highly recommend you do. That would be marked as other. Then you'll be marking the type of a claim submission. When you are completely set up with Office Ally, then you will have the option of electronic claim submission through Office Ally. If your account with them is not yet set up and connected, you'll only have the option of paper claims that you can print and mail or simple claims list. So for now, you can set it to either paper claims or simple claims list. It won't matter. And then once you get connected with Office Ally, you'll just simply go through and set up each company and just flip the switch here by selecting electronic. Okay. You may have some companies that you're going to send paper claims in yourself, and that is totally your choice. Do you accept assignment is the next question, and the answer to that is if you are in network with the insurance company, the answer is typically always yes. Send the check to me. If you bill out of network and have clients pay you full fee and you're just billing on behalf of the client, then the answer is no, send the check to the patient. We can't guarantee insurance companies will abide by that. It is a place on the CMS 1500 form that gets filled in. So I would just, be cautious about that if you're billing out a network where the check ends up actually going. Okay. And then it's going to ask you what the insurance payer ID is for this company. So if we were to go and look up on Office Ally and see what that ID number was, let's just say that it tells me that it's 85972. Okay. And then there's room to put the claims mailing address for this insurance company in this area. I do encourage you to do that you have a payer ID number and also a claims mailing address. And that is because if you ever need to print a paper claim, then the claims mailing address will be printed on the paper claim for you automatically. Or if you do any secondary insurance billing, it'll fill out that format correctly for you. If you don't know the claims mailing address for an insurance company you're on panel with, typically if you look at a past EOB you have received from that insurance company, that is the claims mailing address. They have it listed right there. So it's usually a P.O. box, and 123, and then a city, state, zip code, and phone number is not necessary. Your provider ID number. This is a number that might be specific to this insurance company. This is not where you would place your NPI number. This is not where you would place your tax ID number. This is where you would place your Medicare TPAN number if we were entering Medicare into our library right now. 99% of the time, this is going to be left blank unless it happens to be a government entity such as Medicare or Medicaid. Okay. There's a red line, and in blue here it says, please don't change these items below unless insurance companies are being rejected because of them. So we have our system set up to manage 99% of insurance companies and how claims should be formatted. There are a few out there that have some weird things, and they're typically Medicaid contractors, that they want something different in a box or two. So if you happen to know that right now, you can adjust that. So, example, if you know in box 33 they don't want it left blank, instead they want the provider ID in there, then choose provider ID. So you can manipulate this as you need to, but I recommend that if you don't know if anything needs to be different, you leave it, because if you get a denial on a claim, it'll tell you exactly what's missing, and then you can go change it for that insurance company. So it's going to be set up for, like I said, 99% of insurance companies out there. All right. Just to let you know, this area is going to be changing a little bit on Monday. Monday, a new CMS 1500 form on April 1st goes into effect. the entire country switches over, and the forms are going to have more room for more diagnosis codes. The boxes are going to be changed around a little bit. So you might see this area be a little bit different. We're going to maintain all your information as it is. There's nothing typically in this area that's going to change. And so we don't expect to have any glitches on that. We've been testing it thoroughly here for the last several weeks and making sure that we'll have it ready to go for you. Okay. And below this red line at the bottom, you have an option. If you're in a group practice, and let's say this is the first account you're setting up in the system, do you want to enter this insurance for just this one account, or do you want this insurance information to go to all therapist accounts in your group that you're going to end up setting up as a group practice? So you can choose either one and click here when done. It's going to tell you the insurance information has been entered, and if we go to this insurance database again, we'll see here is my Diamond Insurance Company. If I click on it, it gets me back to that field where I can make any adjustments that I need to make. If I do not wish for this insurance company, if I entered it incorrectly or if ended up with two of them, as long as I haven't assigned it to a client yet, I can just delete this out of here, type delete in the insurance company name, click here when done, and that information was deleted. Okay. All right, so that is setting up your insurance database. That is step one. After you set up with Office Ally, this is step one. I would recommend you enter insurance database information first before you start entering any patient information into our system. And I'll show you why in a minute. So if we're entering patient information into the system, we're going to be entering and clicking the New Patient button. It's going to be asking for a name, last name, email address if we know it right now. This is important if you're registering a brand new patient and want to send out a patient packet via email to the patient. But right now, if it's a current client, you probably don't need to do that at all. So you'll just choose to continue entering information or set up an appointment right now. And if I choose to continue setting up information, what we're going to do is we're going to get to a field that looks just like this. I'm going to expand this section. So it's asking me for patient's name and date of birth and gender and marital status and employment status, because these are all things that are asked for on a 1500 form. And we're going to be pulling from this information in order to fill out those 1500 forms or electronic billing automatically when you see this client. So a couple things I just want to bring your attention to, and that is there is a place for diagnosis here. You please feel welcome to leave that blank when you write your first chart note and diagnose a client. On the chart note, it will autofill this section in, so it will override what you have written here. If it is a current client, you want to go ahead and enter diagnosis, feel free to do so. Date of current symptoms, that's usually the first date that the client came in to see you. And then the rest of this information is typically only needed if you're doing workman's comp type of work. Address for the client, phone and email information, primary insurance policy information. Okay? So if a client were self-registering online, or you're talking to a new client on the phone for the first time, the client might tell you, oh, I have Magellan insurance. So you're going to put that in there and ask for the phone number for Magellan, 800. Okay. And when you might call and double check, the client does have benefits, but if you get in there a little bit further, you might discover, as I do sometimes, that, ooh, I'm not supposed to bill Magellan for this mental health claims. I'm supposed to bill Aetna instead. So what you're going to be doing here under primary insurance company is you're going to be choosing from this drop-down menu. You can see that this is all the insurance companies you've already entered into the system. The default is going to be set to private pay. So as you've just entered a client into our system, it says primary insurance company is private pay. The client doesn't have insurance. However, if I know that I'm supposed to be Aetna billing for this client, I'm going to choose Aetna. And from that point forward, it says when I submit claims on this client, they're going out to Aetna, even though I've said Magellan here in up here at the top. This is where they're sent. Insurance ID number, group number, or none, or leave it blank. effective date if needed, referring physician, very rarely needed. Primary insurance, who's the insured party? It may be the client themselves. It may be that the spouse holds the insurance. So you have this information here. Primary insurance benefits and pre-certs. This is primarily for you. If you call an insurance company, it's a place for you to list what their benefits are so that you know if you need to charge them full contracted rate, if they have a deductible left to meet yet or not. In this case, we said there's no deductible. The copay for this client is $40. There is a visit limit of 12 visits over the lifetime of the policy per year, and a pre-cert is not required. If the insurance company required pre-authorization for visits, you would say yes, and then you would put in the auth number here that they give you, okay, and then how many sessions they're giving you, such as maybe they're giving you 10, and the start and end date of those sessions. So let's just say we just called on that, and they said it was from March 14th, and they gave us to the end of the year, okay. So I put that information there. I could even list here who I talked with at the insurance company. I talked to Tammy, and she used ticket number 567101. Okay, so that way if I need to call them back, I can call back and reference who I talked to before. Secondary insurance. If you're going to be doing secondary insurance claims, then you will need to enter the secondary insurance company into that database of insurance companies so you can select it from this area. So you would just select, if it is to be secondary, you would just choose that just like we did up above. In most cases, it's probably going to be there is no secondary insurance, but if there is and you need an authorization number, who's the person who's insured, what is their date of birth, is there a policy number, is there an employer? Okay, so all that being said, you're going to fill that in, and if you left anything out necessary for billing, then our system is actually going to tell you that you missed it. So as I enter this patient information, it's going to audit everything we entered, and it's going to tell me if something is missing that's necessary for billing insurance. It's telling me I don't have an authorization number entered, and I need to correct the errors noted before attempting to file an insurance claim for this patient. I may not have that information right now. I may need to go back and get it. So we're not going to let you forget about it. We won't let you send a claim off without it, without warning you first. That when I get that auth number, all I need to do is go back in, go to the section, put in the auth number, save my information, and now I get it's a valid, I'm valid and sufficient to file insurance claims for this patient. And to verify the diagnosis I intended to assign is major depressive order. Okay, so if that's cool, we're done. So that patient's now in my system, and it looks like they're all set up and ready to be billed for insurance whenever I see them in the next time I see them. Okay. Any questions about that patient information area and setting up the information there? I promise you we will let you know, in the majority of cases, what's typical and necessary for billing and audit that for you. Make sure you have all the fields entered. Okay. What I'm going to go to next is just a review of the information that you put in when you signed up for your account. When you signed up for your account, we asked you for things like your name and your tax ID number and your NPI number, and we entered it into the system that you can now find under Preferences. I highly recommend it is worth 3 minutes of your time to review your Social Security number and NPI numbers for accuracy, because insurance companies recognize claims and who you are by your NPI number. If you do not have that in there correctly, you've transposed a number, then it's going to get rejected. So I just encourage you to double check and make sure it's all there. So you need if you're an independent practitioner, you need to have your personal tax ID or your employee identification number, Social Security number, however the insurance companies recognize you as a credentialed provider. That's on file with your insurance companies. Or is this, and then your NPI number here. Your personal taxonomy code. That is very specific to the type of license you hold, such as a different code for marriage and family therapist and social work or licensed psychologist. So it's only necessary, though, typically for Medicaid and Medicare billing. So if you don't bill Medicaid or Medicare, you can leave that blank. Your mailing address, very important. This is where you are going to be seeing clients. It has to have a 9-digit zip code, and it cannot be a P.O. box. Insurance companies will no longer accept claims P.O. boxes because of too much fraud. And so that's a law that was passed about a year ago. So it has to be a street address. There is a way to recognize a P.O. box with sending in some forms and a little red tape. But if you don't have to do a P.O. box, I would highly recommend that you do not. Okay. Your practice group preferences. If you're in a practice group, this is where you'll list the group name and the group NPI number. If you're not in a group, you're just an independent practitioner, this section is blank. Service locations or where you meet with the patients. Leave these blank if you only see patients at the address above in the mailing address contact information. But if you're an entity that you have 2 different offices, or maybe you see some persons in nursing homes, then you would set up each of these locations. You can abbreviate and name the location. Going to choose the code for the type of location that it is. Maybe you do home visits, your facility location name and everything. So you have the ability to set those up as needed, but it will be blank if you only have one location you see patients at. All right, area here for system preferences. Several things here are unique to billing that I want you to be aware of. One of those is, right now, do you want to convert DSM-4 codes to ICD-9 codes on claims? And my recommendation to you here would be yes. That is because the DSM-5, currently we are using, the DSM-5 codes are ICD-9 codes. So I don't know if it makes that much difference, but if you are a nurse practitioner or a dispensing practitioner, I'd highly recommend saying yes to ICD-9 on claims. The other thing is, down here, suggest resubmission of unpaid insurance claims after blank number of days. How soon do you want us to let you know if insurance has not paid you? And 30 days is pretty typical for electronic billing. Most electronic billing is paid well within 30-day time frame. If you are doing any paper claim billing at all, I would recommend you leave this at 45. 45 days for paper claims is typically sufficient. It does take longer for insurance companies to process paper claims. If you think about the additional mailing time, and they have to feed it through a computer scanner, so it doesn't happen automatically like electronic claims do. Also, down here at the bottom, claim form, what you feed into your printer. Blank paper, not recommended. Now, if you'd like to just print a CMS 1500 form in black and white on blank paper, that's fine. Insurance companies, if you're billing insurance companies directly, then they usually prefer to have it printed on the red forms. And if you click this menu, you'll see that you can do pre-printed red form. And once you print once or twice on a red form, you have to adjust printer settings because every printer is different. These selections allow you to adjust printer settings. And once you set it up for this printer, you're ready to go, no problem. Okay? So save all our changes here, if any. All right. Guess what? We're almost ready to bill. The only other thing we need for insurance billing is a CPT Go database. We had you set this up at the same time when you were setting up your account. And you need to have fees for add-on codes that you typically bill. Most of us maybe interactive complexity. And then your billing codes are listed below. We started you out with some of the basics, such as a 90834, 90791, 90847, and assign your usual and customary fee to these codes. You can create any additional codes that you would like to create, either standard codes that you're finding in procedure texts, or you can set up your own unique procedure codes for things like phone counseling or report writing or coaching. And any code that is not a numerical code that starts with 9 will not be recognized in our system. We do have a few codes specifically for Medicare billing that do not start with 9 that are recognized in our system already. But if you put in coaching 15, even if you have an insurance client, if you're charging them this code, insurance will not be billed for that code. So late cancels, no shows, it'll be assigned to the client to pay, not assigned to the insurance company, and no billing will go out because of that. Okay. So you have room to set up unlimited codes, or this just keeps growing as you add more codes. So you can click here when done. There's just kind of a list that says these codes won't be billed to insurance, just like I just talked about. Okay. Guess what? Now we're ready to bill insurance. Okay. So the first step is going to be putting a client on my schedule for the day. So today, on Friday, March 28th, I have George Washington, and I saw him at 9 o'clock this morning, and it's time to chart on his session. And let's say I have another client coming in right away, and I don't have time to chart on George Washington. So what I can do is I just need to enter the CPT code for the day, and I need to go ahead and enter how much he paid me today, has a $100 copay, and I'm charging $100, and he has a past due amount of $10. I'm charging him $110 today. Diagnosis code is listed here. Same diagnosis as last time. I could update that right now if I needed to. Appointment time. I'm going to just hit go chart this. It's going to tell me there's a problem with this chart note. And it's then going to show up yellow on my screen. Showing up yellow on my screen means the session is queued up for billing to insurance, but I have not yet completed my chart note. Okay, so if I needed to send this billing out, so let's say it's Friday and I want to get my billing out, but I don't have time to do my chart notes today, I could submit billing at any time I'm ready to submit billing by simply going over here to this claims button, clicking the button, and it's warning me that you should do this rarely without finishing your chart notes. But here are claims that are ready to be submitted to insurance. We can see here's the claim for George Washington that was just created. You'll notice it's green in color. There's a claim on John Smith that was done yesterday, and it's red, and it's warning me that his date of birth was not entered, so we're warning you not to submit that claim. It's going to get rejected. There's claims that we're resubmitting on Rocky and Sammy Soap Note. So everything in green's been audited. It's good to go and send out. John Smith, red, we're warning you not to send it out yet, although you could force it to go through if you want to by clicking this checkbox. And then the claims below under this area have not been paid in over 30 days. Remember that line we just looked at in preferences, and I said how soon do you want to be notified if claims have not paid in a timely manner? 30 days. So we're telling you that Anna Abel has 2 claims here that have come back and insurance is not paid yet. So we haven't got claims back on them or anything. And we haven't heard anything from the insurance company. Typically, I don't want to submit those right now. I want to go do a little research first. So I could submit these right now, or I could just let them sit and keep putting claims in for the day as I saw clients, which is what I'm going to choose right now. But I want to show you the preferred method of billing. And that is that what you would do here with George is that you would then go back and chart his note for the day. And I'm just going to put a note in there. Okay, if you need to update diagnosis, you can do that. And I'm going to chart my note. All right. Now George Washington turns green on my schedule. That's what we like to see. Green on the schedule. And let's say that George is the only client that I saw today, and I'm done and complete. You need to lock your day. Locking does a very important thing. Locking the day can be done by the clinician. It can be done by an admin. But it's going to give a review of all the clients seen today. It's going to tell you the diagnosis being billed, the CPT code being billed, the money collected and what type, the notes were written, yes, and insurance being billed as Amerigroup. It is a last review before you get ready to submit claims. If you notice anything here that needed to be changed, such as, oh, no, he paid by check, not cash. Let me go change that. I'm going to go into George's account, click on his chart note, say he paid by check, and enter that check number, and then I'm going to go ahead and chart this. Okay. And now when I hit that end of day button again, it does a review, and that looks correct. So now my records get locked. HIPAA says you have to lock records in a reasonable amount of time. Locking also counts down the number of sessions you get under managed care. So lock records and review claims. Here are claims ready to be submitted to insurance. I can submit the ones I'm ready to submit. Everything in green I'm going to submit. I'm going to let this red one sit here, and I'm going to let these two sit here as I want to research first. Submit these claims. You just filed your electronic claims. Now what happens is Office Ally is going to receive those claims, and they're going to send you a notice via email that you set up with Office Ally to say, we just got your batch of claims. And then they're going to send you an email a little while later and say, we accepted your batch of claims and there were no problems, or there were problems in that batch. Now you can ignore those emails, because one of the things that we will do is we will let you know if there are any problems with that batch that come through, and we'll tell you and put an urgent message here in your account to say there's a problem with those claims. And if you'll click on your messages button, you're going to get to the messages area and you'll be able to read it. It'll be right at the top of the screen. And I'm going to bring you up a screenshot here to show you what that would look like. If you opened up the message, it would look something like this. It would tell you that the claims that are accepted are here, but you have some that were rejected. So I just sent out 9 claims, and it accepted 7 of them. It rejected 2. And here's the error code, RC07, duplicate claim within 90 days. So guess what? This was a situation where I had not turned off that duplicate filter in Office Ally. I had resubmitted claims because I realized I needed an authorization number for a client. And now it's coming back and saying, you can't submit these, it's duplicate claims. If my duplicate claim filter had been turned off, these would have went out just fine. So right now I can see what the problem is. This is going to be your cue to go turn that duplicate claim filter off in Office Ally, and I need to go resubmit those claims. So I need to fix what needs to be fixed. So let's just say that it says it was a bad zip code for this client. So let's just pretend like this was George Washington and these were the 2 dates of service. So what I need to do is then I need to go into George Washington's account, okay, and I need to find those 2 dates of service, and I'm going to do that by going to his posting screen, and I see every date of service that I've seen George Washington on, and I just submitted claims on, let's say it was 314 and 311, and they're telling me that it's a bad zip code. So what I need to do is go change the zip code in George Washington's account. Maybe I transposed some numbers or something like that. So instead of 12345, it was 12354. I'm going to change that zip code. I'm going to go to that posting screen. I'm going to choose the 2 dates of service that need to be resubmitted, and I'm going to go under this resubmit claim area, and I'm going to hit batch. You're going to see it turn green, and I'm going to hit batch. You're going to see it turn green. Those 2 are now in queue, ready to be submitted to insurance in their corrected form. And then everything from that point forward that you're going to bill out in future sessions will be correct, just to let you know. So you want to correct it. And if I want to go submit those claims right now, I can click this claims button, and there's those 2 claims ready to go out, submit claims. Okay, so I just saw there was a problem. I fixed it and sent it out. You see how fast that was? It took me literally less than a minute. Would have took me less time if I didn't have to explain it. So I just submitted that claim. You're going to get another report from Office Ally. We got your batch claims, and yep, they look good. We sent them on to the insurance company. Now, this posting screen is going to tell you where a particular claim is every step of the way in our system. So every date of service for a patient has a notes button here. And if you click on it, you'll be able to read the process that you've went through for that claim so far. So let me show you an example of that. Again, I need to bring a screenshot up because I don't do bogus claims to insurance companies. I don't want to go to jail, but I'm going to bring up a different webinar screen so that I can show you what that would look like. So I'm going to show you the list for a client who everything's complete, insurance paid, and everything was fine. So if I push that button on the posting screen, I'm going to bring up the notes that have happened. So this is going to tell me the day the claim was sent out and Office Ally got it, it was a clean claim, it was assigned a number and forwarded to the insurance company. And on the 19th, the insurance company accepted this claim for processing. So right there I know the insurance has this claim. So the problem is not in my end if there's a problem, or Office Ally, insurance has this claim. And on the 24th, so we're talking 5 days later, insurance pays me for this, and it paid me by this check number, and it paid me $82.72, and our system automatically posted this along with all the adjustments that needed to be made for contracted rate. So in other words, this claim was paid, and this is the EOB for this particular claim for this patient. So everything that happens with a claim is going to be listed right here if you're sending it out electronically. And if you're receiving ERAs electronically, it's all right here as well. So this is where you can follow up on any individual claim. And the nice thing about our system is if you need to follow up on a claim, you have two places to do that. Okay. So the first place is you're going to get reminded if there's any claims that are having problems and you need to go and look at them. So I might want to go to Anna Abel, click on posting, and look at those dates of service. Okay. And Rhea, if you can hear me, I just had Rhea say she lost connection. And I'm going to type back here that I can hear you, Rhea, and you're still connected. We're still going. Maybe your insurance, maybe your if you haven't touched your screen or your keyboard in a while, sometimes those just time out for you. So you might want to check that. And let me see if I can type that in here. Okay. The other thing is for insurance companies is you're going to have it there under the insurance base. The other thing that you have is the ability under bad claims. So any claims that have not been paid or paid in full, either by insurance or the client, are going to show up in this bad claims area. This bad claims area is going to tell you of any transactions that are problems. Private pay patients will be at the top. So these aren't claims, but they're transactions where there's a balance due, or in this case, there's a balance owed back to the client. There's a area here that says I owe the client. We have a credit of $100. But let's say I'm going to TRICARE South here, and here's my clients under TRICARE South whose claims are problem. B-Bio, Swami Soap Note. I've not gotten any insurance payments from TRICARE. I can see the date of service here. I can see the date it was last sent to the insurance company for processing, what I billed out, and I'm just not getting paid. And I'm not hearing anything back from the insurance company either. If I want to take a look at it, what's on those note sections, I can hover over this little star and read it, or I can get directly to that patient's posting screen. I can go to that date of service, and I can take a look at what's under that edit button. If anything, you would have a lot more information here, but I'm sitting there going, yeah, well, in TRICARE, that was generated, but it never got there for some reason. I don't see any of those messages back about this claim, so I'm going to resubmit this claim. Okay, my system doesn't really submit claims, so we're not going to have all those messages here. So I'm going to resubmit that claim on Betty Bio. So great, let's do that. So we can just go to Betty Bio's information page and send that claim on through. So we're just going to hit batch and process it in the next batch of claims. Okay. All right. I have taken you through the process of submitting claims, looking at the clearinghouse, that bad claims button, how to fix a claim, what's wrong, and resubmitting a claim. Now, you might have a claim come through that has a different thing to be fixed. So if it comes through and it says patient zip code does not match state, where do you think you go to make those changes? You would go to the patient database, okay, and look up the patient's name and go into edit info and fix that zip code and then resubmit. What if it came up and said the provider's ID number is missing or invalid? Oh, that would mean that I'm the provider. That information is going to be found under the preferences area where I have my identifying number, and that's all there. So I wonder if the insurance company needs something else there, if it's under the insurance database and they need me to have, for example, maybe they need my provider ID listed somewhere or something in a certain blank. So you can tell by what the problem is where you need to go into our system and fix it. It has to do with clients, it's in the client information. If it has to do with your provider ID numbers, it's either in that preferences section or that insurance company requires something in a different blank to be sent out. Okay. One thing with claims, we know that our goal is for you to get paid for your claims. And if you will call our 800 number, 242-2127, option 2 gets you to our claims specialist. Lisa is on staff with us, and she is an excellent resource. She's a claims specialist. She used to work for the insurance companies. So she knows all the tricks that need to be done if you're getting claims continually rejected. For clients in general, she can certainly help you and make sure your system is set up properly if that's happening. Don't be afraid to call her. And then also on our website, you have the ability to submit a ticket and contact us for support. And if you'll submit a ticket, a lot of times let us know the information, like saying, I'm having problems with Magellan and getting claims submitted, and this is the error code I keep getting, and I can't figure it out. Send that to us. Our claims specialist, Lisa, or one of the other of us who knows about it, we're going to answer that, and we'll get you answered back ASAP. So you can call, you can utilize this, you can look at our, you can also look at our, if I go back to the beginning screenshot that I want to get to, our support options. You can view the latest software updates, read our help articles. There's an article on just about anything in here, insurance claims, error codes on claim rejections, more topics. So we have a lot of topics here, and people have rated them as helpful or non-helpful. So you can take a look at that and probably find the answer to your question there as well. Okay. I have done a lot of talking. I'm going to turn the phones off of mute and see if you have any questions real quickly.